Hello everyone, I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist here at Healius Cancer Clinic. So, September is Thyroid Cancer Month. So, let me take this opportunity to talk a little bit about thyroid cancer surgery. Now, thyroid cancers are of various types. The most common one is what is called papillary cancer of the thyroid. Now, if you see the aggressiveness of the cancer, most of the papillary cancers of the thyroid are not very aggressive cancers. They are quite indolent. It is not uncommon for patients to have a thyroid cancer without any change for months or years together. And it is quite rare for people to die because of this thyroid cancer. So the treatment results are also quite good. So what is the surgery that is to be undergone for a papillary carcinoma thyroid? I am talking of a situation where the person has got a thyroid nodule, has undergone an ultrasound, and also has undergone a needle test, and the needle test is telling that it is a papillary carcinoma of the thyroid. Now, for a very early cancer, which is say just limited, a small nodule, say about 1 centimeter, limited to one side of the thyroid with no lymph nodes, these are thyroids we consider as low risk, especially if it is in the age also matters here. So, in these low risk groups, now more and more it is being thought that just hemithyroidectomy or half removal of the thyroid is sufficient for these types of thyroid cancers. Earlier, we used to think that all papillary carcinomas require total thyroidectomy. The reason given was that one, they are multicentric, and second, the next treatment, which is radioiodine treatment, can be used only if the full thyroid is removed. If the other half of the thyroid is not removed, whatever radioiodine is given will all concentrate there and it will end up as useless. But now we realize that in these low risk groups, the chances of the cancer developing on the other side, one, is extremely small, and most of these patients do not require the radioiodine test. So, in these favorable risk groups, especially small tumors, we prefer to do a hemithyroidectomy nowadays. But we also have to identify which are those which are higher risk, a big nodule and those in which there are other lymph nodes. So these are the ones in which patients have to undergo a total thyroidectomy or full removal of the thyroid. In this procedure, there are two major complications which we need to keep in mind. The nerves which go to the voice box go very close to the thyroid. So it is possible that after the surgery, there may be a slight change in voice of varying severity. A very severe change or a long-lasting change is highly unlikely, but happens in a small fraction of patients. The other complication is there are small glands called parathyroids just behind the thyroid. These are responsible for maintaining the calcium level in the body. If these parathyroids get damaged during surgery, then the patient may end up with hypoparathyroidism, which leads to lower calcium in the body, which leads to tingling and numbness of the hands and legs. This is also most of the time temporary. Long lasting calcium deficiency, low calcium levels is pretty uncommon. Along with the removal of the thyroid, it may be necessary to sample a few lymph nodes around the thyroid so that we are aware what exact stage the cancer is in. It has to be done by an experienced surgeon because improper surgery leads to a lot of complications. But the results are very good. Papillary carcinoma, expecting cure is the norm. Most patients get cured, if properly treated, get cured of this cancer. With regard to other thyroid cancers, follicular carcinoma, it has more tendency for blood-borne spread. But by and large, it is treated on similar lines like papillary carcinoma. The other type, medullary carcinoma, here there is some chance of familial tendency. Some of them tend to be familiar. Here there is not much indication for hemithyroidectomy, and most of the time we go for total thyroidectomy along with lymph node dissection. So much about surgery for thyroid cancers. Thank you.